helping you make intelligent decisions on breast cancer treatment. Rachel is in the prime of her life. She is in great health, has a wonderful family, and a promising career. Everything is under her control. But one day, she is diagnosed with early-stage breast cancer. She is overwhelmed by the discovery and the associated risk of recurrence after the surgery. To prevent breast cancer from recurring or spreading, adjuvant therapies are needed. Conventional treatments include chemo, radiation, targeted, and hormonal therapies. The goal of post-surgical adjuvant chemotherapy is to reduce risk of metastasis or spreading of cancer to other locations. The goal of post-surgical adjuvant radiation therapy is to reduce risk of local recurrence. Each treatment has its purpose, benefits, and severe side effects. For example, chemotherapy can cause hair loss, nausea, and vomiting, while radiation therapy may increase the risk of pneumonia, lung cancer, and heart disease. Rachel struggles with the options. Can she find an adjuvant therapy strategy that is just right for her? Her doctor tells her that cancer treatment has entered the era of precision medicine. By examining a specimen of her tumor, the doctor can predict the risk of breast cancer recurrence and spreading in order to determine the appropriateness of radiation or chemotherapy. Prior to the discovery of biomarkers in the past, post-surgical treatments for breast cancer could result in either over or under treatment. As a matter of fact, only 20% of early-stage breast cancer patients need to receive post-surgical chemotherapy. The other 80% of patients would be over-treated and therefore would have to deal with side effects unnecessarily. Existing genomic tests in the market are developed based on European and American tumor genomic profiles. Given ethnic differences at the genetic level, these tests tend to overestimate the recurrence risk of Asian breast cancer patients. RecurIndex can effectively predict the risk of recurrence and spreading for up to 5 years after undergoing breast cancer surgery. For example, if the report indicates that a patient bears a high risk of local recurrence, it means that the average chance local recurrence is above 40% and that the patient should undergo radiation therapy to reduce the risk of recurrence. If the report indicates that a patient bears a low risk of metastasis, it means that the average chance of metastasis is below 4% and that chemotherapy can be reduced or avoided to prevent unnecessary side effects. RecurIndex has 7 major features. First, it was developed based on a genomic database of Asian breast cancer patients, and it is the only genomic test for which clinical evaluations on the breast cancer recurrence risk of more than 1,000 Asian people have been conducted. Second, RecurIndex has filtered a patented genome that is highly relevant to the recurrence of breast cancer for Asian people from more than 7,000 genes, including functions such as tumor hyperplasia, base material invasion, immunoregulation, and cell metabolism. The risks of local recurrence and metastasis for each patient are calculated accordingly. Third, the research has been ongoing with top research centers globally since 2000. The findings have been published in well-known academic journals, and clinical trials are in cooperation with Industrial Technology Research Institute and major medical centers globally. Fourth, it is the only genomic test that can predict local recurrence risks. It can identify high-risk patients to prevent insufficient radiation therapy. Fifth, the technology also predicts the risks of metastasis and therefore identifies low-risk patients and prevents unnecessary treatment. Sixth, the technology is able to predict risks of local recurrence and metastasis for all breast cancer subtypes. 7. The technology analyzes expressions of breast cancer subtype genes such as ER, PR, HER2, and Ki67 as a supplementary reference for IHC. RecurIndex is the only breast cancer recurrence risk test developed based on an Asian genomic database. Precise, developed based on Asian genes and predicts risks more accurately for Asian patients. Comforting, capable of predicting both local recurrence and metastasis risks. Comprehensive, coverage includes both stage 1 and stage 2 breast cancer patients, regardless of subtype. RecurIndex helps Rachel in making a treatment decision more confidently with scientific data, restoring her hope for a brighter future.